from the age of about 18 to around 23, 24, they're in college. So you can imagine this is the first time you're getting that freedom, all right? And you go to college and you get a boyfriend, right? And certain things follow, you want to get intimate. So there's that conversation either with your partner, like, should he use a condom? Should I use contraceptives? Maybe it's even easier for a girl to tell the man, get a condom, right? But for her, there are a lot of misconceptions about contraception. She's not sure where are we taught about contraceptives? I don't know whether in high schools they teach people about contraceptives. Maybe not, right?
Like they already say, there's a lot of myths surrounding contraceptives. And then that entirely leads to low uptake. And we find communities suffering from preventable public health issues, public health concerns, like unsafe abortion, unintended pregnancies. We're having STIs, especially HIV, on the rise. So how do we demystify the myths surrounding it?
It basically stems from the stigmatization that is there. So there's the preconceived judgment. So people find it quite hard because they fear being judged. They fear that they're not perfect, or they're generally just being judged. Yeah, it's a great fear for most people.
Yeah. I don't know how your experience has been in the public now. There's some people who knew you before, and then now has their image of you changed? And do they have conversations with you about either contraceptives based on your character, or are there lessons that you learned from playing the character that you would openly share about contraceptives?
The society has expectations of is now the fear of judgment in things. But as for my character, Jerry taught me a lot.
Like unsafe abortion, unintended pregnancies, we're having STIs, especially HIV, on the rise. So how do we demystify the myths surrounding it?
Give you an example. Say, for example, here's a woman. She got married, maybe she was even Alice, maybe 18 years old. And you find by the time she's 25, she already has 6 kids. So meaning she was getting a child every year or every other year, isn't it? It's not even healthy for her.
Yeah. So you have to breastfeed exclusively, and then also your periods shouldn't have started for you to use this method.
Welcome. We are back on the MedSquad Podcast. My name is Yafesi Musoke. Now, picture this, walking to the shops because you want to buy, whatever it is you want to buy, there are 2 people there talking to the shopkeeper. And so you ask for cocoa. And then you ask for cola. And then you ask for cough lozenges. But after piling up toilet paper, bread, milk, everything else, these 2 people leave. And what you were asking for was condoms. Why is it so hard? We're going to be talking about contraceptives. And I have with me a wonderful panel. I think I'll allow them to introduce themselves from my left, because we read from the left to right, but you're seeing it the other way. You know what? We'll just start from this side.
Thank you. I'm Dr. Flavia Patete. I'm a medical officer, and I'm very passionate about women's health.
Thank you. Hello, everyone. My name is Eva Orohio. I'm the VP in charge of women health here at Zuri, and also very passionate about women health. And looking forward to have this discussion of condom.
Hi, my name is Taylor Kendi. I am a Kenyan actress, content creator, and student. I'm also quite passionate about women's reproductive health. Yeah.
Welcome. Now, of course, what we'll do when we start this conversation, there's so many elements surrounding it, but we'll start with you, Taylor. In fact, some people probably don't know yes, Taylor, unless they read very carefully. People have shouted, hey, Jerry. So there's the issue of growing in profile. Now in Kenya, as far as I'm concerned, people don't gain celebrity. They lose anonymity. So, as now a non-anonymous person, why do you think these conversations about contraceptives are so hard to have?
It basically stems from the stigmatization that is there. So there's the preconceived judgment. So people find it quite hard because they fear being judged. They fear that they're not perfect, or they're generally just being judged. Yeah, it's a great fear for most people.
Yeah.
Yeah.
Now, Eva, is this a consequence of misinformation or stigma? What is it?
Yeah, it's interesting you ask that question because especially among young people, from the age of about 18 to around 23, 24, they're in college. So you can imagine this is the first time you're getting that freedom, all right? And you go to college and you get a boyfriend, right? And certain things follow, you want to get intimate. So there's that conversation either with your partner, like, should he use a condom? Should I use contraceptives? Maybe it's even easier for a girl to tell the man, get a condom, right? But for her, there are a lot of misconceptions about contraception. She's not sure where are we taught about contraceptives? Yes. I don't know whether in high schools they teach people about contraceptives. Maybe not, right? So it is the first time she's now interacting, with contraceptive, but she doesn't know where to start. I mean, there's so many out there. Does she use an IUD? Does she use a semi-permanent one, like the injection or the implants? So it's actually misinformation. The information out there is there. The information is there, but she doesn't know how to decipher it. And no one is helping her to decipher it. So maybe they'll talk among their friends, like, what do you use? And also what I've come to realize, when you talk to young people, they're not even honest with each other, right? So again, even the information that they're getting from their friends is not accurate. So I feel it's our responsibility to actually have that education, to actually educate the young people, especially, I think for me, because we're talking about women health, to educate the women that they are in charge of their sexual and reproductive health. Yeah. So they need to make the right choices, and the right choices for them as an individual. So it can't be group work.
Yes.
Yeah.
So, Dr. Flavia, this, we usually put the pressure a lot or talk about young people a lot. But when it comes to contraceptives, it cuts across ages. So medically, how do we demystify this whole conversation?
Mm-hmm. Like they already say, there's a lot of myths surrounding contraceptives. And then that entirely leads to low uptake. And we find communities suffering from preventable public health issues, public health concerns, like unsafe abortion, unintended pregnancies. We're having STIs, especially HIV, on the rise. So how do we demystify the myths surrounding it? We provide information. Like Eva said, we have a lot of contraceptives out there, and also people are at a loss of choice. We don't know which one. People don't know which one would work for me. And then also people talk about side effects, but you don't know which side effects are particular in which one. So we need to provide information. We can use technology, provide video aids, information in form of apps, where an app can do everything for you. You ask the app questions, and then they give all this information to you. You ask the side effects, and then they give it to you.
You can also use the MedSquad podcast.
Exactly. So yeah, we can do that. We can also use telemedicine to do virtual consultation with doctors. You consult a doctor virtually. They can also make you a virtual prescription instead of just going to the pharmacy and getting this for yourself.
Yeah. So when you're talking about the options that you're going to communicate, walk us just through some of the options that are available, and also include men in that.
All right. So the options, we have the hormonal contraceptives, we have the non-hormonal contraceptives. So I'll start with the hormonal, with the non-hormonal, because some people just want the natural ones.
Yes.
Prefer the natural ones. So we can look at fertility awareness method. This is where you use your days to know when you're fertile. So it's important for a woman to know her cycle when you're going to use this method. And it's best used for someone who has a regular cycle. So basically, you use day 1 of your menstrual period as number 1. Then day 2 is number 2. So you go on like that till day 14. So here I'm using a 28-day cycle. So day 14 is the day of ovulation. So 5 days before ovulation and 2 days after ovulation. That is your fertility window.
Yeah.
So you can have unprotected sex all those other days, but not these ones.
Is that standard, or does it vary between different women?
On average, majority, that is standard. But people have different cycles. Some have longer. It can be from 30, 32. Then some have shorter even, 21 days.
Okay.
So it needs someone who has It has to be regular, and it has to be between at least 24 to 35 days, not longer than that, or else it won't work.
Okay.
So we're also looking at, so during that period, your fertility window, you can use another method, a barrier method, maybe like condoms. So we have that fertility awareness. We also have lactation amenorrhea.
Lactation amenorrhea.
Yes. Breastfeeding exclusively.
Yes. As a form of contraceptive.
As a form of contraceptive.
Oh, okay.
Yes, it's natural. So you have to breastfeed exclusively, and then also your periods shouldn't have started for you to use this method. Yes. So this best works for mothers with babies below 6 months. Yeah. Because that's when exclusive breastfeeding is taking place.
And that's assuming the baby allows you to get it on anyway.
Then we're looking at 2 to 3 hours, every after 2 to 3 hours. Then there's also the barrier method. We're looking at condoms, diaphragms, cervical caps. And then...
Is there a difference between the female condom and the male condom? I've seen some of them marketed that way. Male condom, female condom.
There's a difference. Even the way we insert them is different because of our anatomy.
Oh, so the female condom is not just a condom given to the man by the female?
No,
yeah.
It's a female. It's a condom that is made for the female. Yeah. Then the male is made for the male.
Okay.
Because of our anatomy. Then there's coitus interruptus, withdrawal, but the withdrawal method.
Pulling out.
Yes. So though this one has lower chances of success.
Yes.
Then we have the coil, the copper coil.
Yes.
It's non-hormonal.
Okay.
Yes. So it's basically it's a spermicide. It kills the sperm.
Yeah.
So moving on to the hormonal. So for the hormonal, we have an interplay of the estrogen and the progesterone.
Okay. That's all right.
Yes. So for the egg to mature, the brain has to send a signal to the ovary. Then the egg will mature. When it matures, it produces estrogen. Estrogen has to get to a peak. So when it gets to that peak, the brain releases another signal that releases the egg, and then you get ovulation. Yeah. So what the estrogen and progesterone combined pills do, they tell the brain, because these are hormones, these are synthetic hormones, they're telling the brain, we already have enough hormone, don't release more. So the estrogen, the natural estrogen in the body won't get to that peak, meaning you don't have ovulation. Yeah. So that's how they work. Okay. Then also, after the egg is released, there's what we leave behind. That produces progesterone. And progesterone is responsible. You see, the estrogen is responsible for the egg release, but also thickening the lining of the uterus so that implantation can take place. Yeah. And the estrogen is responsible for maintaining that lining. The progesterone is responsible for maintaining that lining. So without progesterone, you're going to use that inner lining of the uterus, and that's how you end up with menstruation. So these hormones, progesterone and estrogen, they tell the brain we have enough hormone. So there won't be the natural hormonal
release.
Yes, release. So you won't have ovulation.
Okay.
Yes. So when you look at the hormonal ones, we have the combined ones, which is progesterone and estrogen, and then we have the progesterone only contraceptives. Yeah. So when you look at the hormonal ones, we're looking at oral contraceptives, the pills. Yes. And then these ones, you have to take them every day because that's how they're effective. Oh, yes. You can't miss a day. If you skip days, you're at a chance of making it ineffective and getting pregnant. So we have that. We have the vaginal rings. Then we also have, like we said, the progesterone only. We have the implants. We have implants that can last up to 3 years. We're looking at Implanon. Then we have Jadel that goes up to 5 years. We have the injectables, the Depo-Provera that can take you 3 months. Then, meaning every after 3 months you need it. You need to, yes. Then we have the IUD. In the non-hormonal, we talked about the copper.
Yes.
In the hormonal, we're talking about the progesterone only, IUD. Yes.
Wow.
So then lastly, of course, we have what they call the permanent method.
yes.
We have the tubal ligation and then the vasectomy.
Yeah.
So I will talk about the vasectomy. It's because
Finally, we've been seen. Yeah.
yes, because it's a simple procedure, but most men fear it.
Yes.
Actually, we call it a minor surgery. It can be done as an outpatient.
walk-in kind-
Exactly, like a walk-in.
It's because they fear sharp objects. Why are you going down there with sharp instruments?
So what happens? They're going to tie the tubes,
Yes.
and so the sperm won't be able to go into the semen.
Oh, they slip the vas deferens.
Exactly.
Hey,
Exactly.
Dr. Musoke in the house.
They tell the vast difference.
Yes.
Yeah.
So the sperm won't get into the semen. But you see, with these methods, even when you say they're permanent, in skilled hands, they're actually reversible. But the chances of success are very limited.
Yeah.
Very, very
Reverse.
limited. Yes. So when we're talking about contraceptives, we're looking at also the duration. There's some, like we said, the oral ones that you take every day, every other day. Then there's some that take you 3 months, and there's some that can take you 5 to 8 years.
Yeah.
We're looking at the IUDs.
Yeah.
They can take you a longer period.
Are those removable? Like if in the 6th year you decide I want a child now, can you be removed, or do they have to reach the expiry date?
They are removed.
Wow.
They can be removed. Even when you decide before that time,
Yeah.
or some people get side effects from them, and they have to be removed earlier than they planned. Then also it is important that you involve a health provider for it.
Yeah.
Don't go and just get any method, because they have side effects. Some of them cause withdrawal bleeding. Some of them, because of the duration, they take, even resume infertility takes some time. So for some, you can take 6 months to 1 year without resume infertility after removal. Then some of them is immediate, like the oral contraceptives.
Yeah.
Okay. Well, on the MedSquad podcast, it's been heavily skewed towards women in that long list. But it doesn't mean that men do not have a responsibility. But when we do come back, we'll be exploring more of this and how perceptions can change depending on who's talking. Stick around.
Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the MedSquad.
Care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks and it enquests.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the MedSquad. Real conversations, real health, real people. From your inbox to your bedside, we're with you.
Welcome back to the MedSquad podcast. As we talk about contraceptives, you're hanging out with Yafesi, of course, Dr. Flavia. We have Eva here and Taylor or Jerry. I don't know which one you know her as, but we'll come to her. Eva, you've had the long list of contraceptives and different types, hormonal, non-hormonal. How do you help, or how does Zuri Health, or is there a way a woman can keep track of this? Because the ones that you may know offhand may not work.
Correct.
And then you get discouraged.
Correct. Yeah. So in Zuri Health, actually, we have a special chatbot. Right? When I talk about a chatbot, it's like an avenue where you can actually chat to a nurse, and it's free of charge. We call it Nikona Choice. It was actually formulated with the young people in mind, especially when I'm talking about young people, I'm talking about anybody between 18 to around 25, not yet married, etc., right? As we say, they can be sexually active, and that is where they don't know. So the first thing that we do is educate them, right? So you can going to the chatbot and talk to a nurse and say that I want to ask the question, what contraceptive do I need to use? So the nurse will engage you in terms of, how old are you? Have you ever used any contraceptive before, etc. And they can even ask you to come to the facility. And the reason why sometimes we ask you to come to the facility is so that we can understand you, right? And your body and all that. And then we can be able to advise you, because you actually find that some women who are not very, what can I say? They can't use hormonal contraceptive because of whatever medical issues that they might have.
Yeah.
There's sometimes you have a medical condition that you cannot use hormonal contraceptives. Yeah. So then we give you non-hormonal. Right. So knowing your body really helps. Some of the misconceptions that we hear is like, oh, but this one I may gain weight. Mm-hmm. Yes, some do. You can actually gain weight, but also we can be able to advise you what to do so that you don't gain weight. Yeah. Right. So you eat well, exercise, etc. And so that education is very important. So I keep on saying contraceptive, not one fits all, right? But what is specific for you. So that education is very important. If somebody is not able to come to the facility, we continue to advise them and tell them to go to the nearest facility to get the contraceptive done, right? So the good thing about here where we are, especially in Kenya, is that health is decentralized. So it doesn't matter where you are in the country, especially if you go to a public health institution, you shall get contraceptive for free, right? And you'll be able to meet with a health worker who will be able to advise you.
Yeah.
Yeah.
Oh, that's very useful. Now, Taylor, swiftly, I don't know how your experience has been in the public now. There's some people who knew you before, and then now has their image of you changed? And do they have conversations with you about either contraceptives based on your character, or are there lessons that you learned from playing the character that you would openly share about contraceptives?
Of course, some things have changed. The change has come in that there is now a certain level of expectation that was not there. Quote unquote, a role model. Yes. So with that coming, it takes me back to the first question you asked me. So for instance, for most people the society has expectations of is now the fear of judgment in things. But as for my character, Jerry taught me a lot. Jerry was scared of the stigma around it. Jerry did not have enough knowledge. Despite being in the medical field, Jerry did not have enough knowledge about her body, and that's why she was getting pregnancy scares. We look at a character like Carol. Carol died due to a botched abortion. And this is because she did not use the right methods and she did not have anyone to talk to. And now with a platform like Nikona Choice, there's now the option of you're faced with something and it's almost as if you have a bigger sister for the ladies that you can easily communicate to with no one knowing what you have said or where you have gone. It's just between you and your bigger sister. Yeah.
Hey, that's actually that's pretty useful.
I like that word. The biggest Nikona Choice is big sis. Who's so wise?
Yes,
and has all the answers.
And is very confidential.
Yes, exactly. It's very confidential. So it's your one-on-one conversation.
Now that's a big point. The confidentiality.
Yes.
So that points once again to the issue of why a lot of women, by the way, regardless of age, and in some cases it could be a cultural thing, why they still feel they need permission to get contraceptives or contraception. So is there, how many factors are we dealing with here? There's the cultural image. Every human being generally wants their own business kept secret. But for some women, even in church circles and other very high profile areas, you find people getting 7, 8 children and then having complications because they're not allowed to by the husband. How do you deal with that issue where women are still having to get permission?
So in our society, in the African society, it is in such a way that that there's male dominance in relationships. So because maybe the man is a breadwinner, the woman feels the need to ask if they need to use any contraceptives. But also you find that in most cases, the man refuses. And then we end up with a woman giving birth maybe every after 1.5 years. But also, there are some societies still where when a woman goes to get contraceptives, the husband needs to consent.
Yeah.
So we should work towards making laws, friendly laws that give a woman the autonomy to decide what she wants and when she wants it.
So let me just add to that, and it's cultural, right? But I feel like there also needs to be an education to the male, population.
Yes.
I'll give you an example. Say, for example, here's a woman. She got married. Maybe she was even Alice, maybe 18 years old, and you find by the time she's 25, she already has 6 kids. So meaning she was getting a child every year or every other year, isn't it? It's not even healthy for her. Yeah, and that's why sometimes you find some of these women are even anemic. Right? They're not strong enough even by the time they're having their 6th baby.
Yeah.
So it's just to let the men understand that actually, for the benefit of your wife, right, she needs to space those children for her own strength and even just for her own body, her anatomy, right? Yes. And the thing is, I think there's also a misconception that if they start using contraceptives, it will reduce their fertility or it will hinder their fertility, which is not true. As she correctly said, there's some family planning methods that can last a year, and after a year, you can still be able to conceive, right? So that issue of what is the reason why you do not want this woman to have to take contraceptives is because you fear that she will not be able to have children after she takes contraceptives. And if that is the case, why do we need to demystify that, right? For the sake of the woman, right? For the sake of the health of the woman, right? Yeah.
So also, it's when you're having this talk, it's important to involve the men.
Yes.
Yeah. So it should be more of a partnership than actually the dominancy. Then religion also affects it, because some religions, like the Catholics, they don't allow certain contraceptive methods. So we should have maybe a dialogue, an open dialogue, and then also comprehensive reproductive health education.
Yes. Actually, for you, what questions should someone ask their provider if they're looking for contraception? Because it's one thing to just say, I need, but starting that conversation can be a bit difficult. So what questions, they're the key questions to ask?
You can ask for the duration of the contraceptives. How long will it, and then what am I supposed to do in between? Will it be 100% effective, or it has some chances of I'll get pregnant at some point? Then you also ask for the side effects. How will it affect you? And then you should also voice out. Don't be scared. First of all, you should ask all the questions you have, and then also talk about your conditions. Let's say if you're hypertensive, you're not supposed to use estrogen containing contraceptives. Also, if you're breastfeeding, you cannot use them, or else they're going to affect your breast milk. Then if you've had, let's say, a clot somewhere, you're not supposed to use again the estrogen ones, because estrogen is meant to, like in pregnancy, it's meant to, let's say, sort of activate the clotting factors so that you don't bleed out when you're pregnant. So that's what happens with the...
Okay, there's one area that I'm very keen on, the abuse or self-medication. Let me call it self-medication. With regard to emergency pill, let's just call it the emergency pill, Postina and all that stuff.
Yes.
What are the side effects of using that as just a regular kind of method?
So the emergency pill, Postina, it has high levels of progesterone, which can bring about, if you repeatedly use it or abuse it, you end up getting hormonal imbalance. You can end up with hormonal imbalance, then you have irregular periods, heavy menses, and of course with irregular periods comes about anovulation. You have, let's say you're having periods every after 2 weeks, and you're not having ovulation, so there's infertility.
Okay. So that's a serious danger. So
let me just say something about that. Currently, in the current statistics that we have, over the weekends, chemists sell more P2 than condoms. So meaning people are actually abusing the P2s.
Yes.
And I'm glad that you brought it up because it's a serious issue. As you say, it's an emergency contraceptive. It's not a contraceptive that you need to be using regularly because, as you say, you can miss your ovulation. Yeah. So, I mean, that's a serious problem.
That's a serious problem.
Yeah.
And so, Taylor, among your male friends, although nowadays it's so hard for you to hang out with any male friends because everyone's like, oh, doesn't Jerry have a new? So anyway, are the male friends open to this conversation about contraceptives, or are they saying no, you just take the emergency pill? Or...
I think what I love with the younger generation right now is that they're very open to, almost as if they've empowered the women around. Yeah. So they're very open to women making their decisions. They're very open to a woman owning up to their body and being able to say, this is what I want to do. Mm-hmm. And also there's a lot of communication. It's a whole thing right now. Everyone wants someone who they can communicate with. Yeah. So the communication of this and this is how I prefer, this and this is what I want. So I think with the males that I know, they're very open to people having contraceptives, to their partners using contraceptives instead of using the P2.
The P2.
Yeah.
And are they also, this information that they're getting, are they getting it from medical professionals or is it Dr. Google?
So with the women, I think even with our generation right now, as much as there's information out there, because of the stigmatization around and all that, also sex education is not part of our curriculum. Yeah. So it's very hard for people to be very open to get the information. So they ask their friends. A friend who might know, and they're not accurate about it. They chat GPT, Google, all this information. Because again, going to a doctor to ask about your reproductive health is, it's stigmatized. You're supposed to be going to a doctor because you're sick. Yeah, so I think that is still a challenge. There needs to be more knowledge on this. There's the need for it to be an open conversation. I genuinely think there's need for sex education in our schools.
All right. Yeah. We also need to provide youth-friendly services where they can go and not feel judged, as opposed to having a mixture of ages. Yes. We have more of adolescent-based services.
Yeah. Mm-hmm. So, like, is that a separate department or area or a system for different age groups, so that people are you're not sitting with their someone older looking at you like, young people, what have you been up to? That's why you're in this section. Or is it a place where you make it more relatable? It's younger doctors, or how do we do that?
Like you said, we're making it more relatable. Yeah. Someone won't come to hospital and feel judged. They come and find their peers there. Yes. Yeah, and also we have more of this peer education. They relate to each other.
Yeah, so let me just also add on to that. So at Zuri, that's exactly what we're doing. I talked about the Nick on a Choice platform where it's free. So you can actually talk to your doctor virtually. So in the comfort of your home, any time of the day, right? So you can actually chat with a nurse and you can ask her all the questions that you have. So that's a safe space.
Yeah.
And this nurse will not judge you. She will just let you know what you need to do, etc., and where to go, right? And over and above that, you can also speak to a therapist. So we also find that young people, due to whatever it is, some of them, you hear stories of either I was molested or I was raped, who do they talk to? So we can actually direct them to a therapist. They can talk to a therapist and even tell them what to do, because sometimes they don't know what to do. Where do I go and report it? So take them through that whole journey, So we are actually creating a platform for young people. And this is actually meant for young people, a place that they can go and feel that they can actually just say what they are feeling, talk about their issues and get proper advice. Yeah. So in that platform is where also you can find Nick on a Choice. But over and above that, you also have a WhatsApp community group called Zuri Babes. Zuri, they are babes, right?
See, look at the reactions.
So Zuri Babes, so it's a community of young women, and they come and engage and talk. And there's so many questions that we get in that platform. And of course, they have access to a nurse, they have access to a doctor, they They have access to a therapist. They have access to a nutritionist, right? So it's a safe space for young women, never to feel that they don't know where to turn to. And also we have an SMS platform as well for people in rural areas who do not have a smartphone and only have a feature phone, where they can also be able to get consultation for free.
All right. You're watching the MedSquad podcast. Now, when we come back, you've heard about how it's heavily skewed towards women. The burden, that's what I'm talking about. When we come back, we'll be talking about owning the narrative as we talk about contraceptives right here on the MedSquad podcast. Welcome back to the MedSquad podcast. This is where we have candid conversations about health and wellness across Africa. Now, when talking about contraceptives, how do we flip the script on the narrative? Take it from taboo to empowerment. And I'll start with Njeri, because now from that area, from that perspective, you said you learned a lot from your character.
Yeah.
How important is it for you, both as an actress and as just a young person, to see yourself represented in positive media?
I think it's quite important. Shows like Njeri, they create an environment where, because at the end of the day, film is look and feel. So it should be very relatable. It should be what the common person is going through. So seeing what you're going through depicted and seeing options there, because with Njeri, by the end of the show, you're able to see, okay, there was this option and this option and this option. This was the consequence of doing this and doing that and doing that. So I think it's really important that we have such shows, because if we're going to reach different, as Dr. said, if we're going to reach different people, different ages, we need to go to use the types of platforms that will be interesting to them. So we cannot call a congregation of people and just have a seminar and talk to them, whereas there are people who don't know how to read, but they can watch and understand because this is the Swahili they speak. You cannot write books for them when they're bored of books they've been studying. So there's so many things that you cannot use for this for a certain age, but then through shows, through social media, through certain posters, you can be able to talk to these people. So I think film, social media, platforms like Nikona Chase also, they're really important. Yeah.
All right. So our platforms are another way of owning the narrative.
Yes, I think it is, especially when you've seen there's a gap in terms of misinformation. When we're talking about misinformation, we talk about misconceptions, we talk about myths. But how do we demystify that? So I think information is power, and that's why we have platforms like Petals, where women and young women are able to ask questions and get clear answers from experts, medics, nutritionists, health experts. So that is what it is. And this platform is available for all women across Africa because it's on a digital platform, so you can access it from anywhere. So I think that is what we need to do first by giving them information. That's how they can make the right choices. And that's what you want them to do at the end of the day, make right choices.
All right. Now, medically, because obviously this information or what we're saying seems to be definitely skewed towards women. But how do we own the narrative medically? Yeah.
So we should normalize talking about contraceptives, just like we were talking about vaccines as a preventable public health measure. So we should for contraceptives, because when you look at contraceptives, we are preventing unwanted pregnancies. We're reducing maternal mortality and morbidity. Also, the health education, the sexual health education, especially for young people, we should use the platforms that we have, like we've been talking about, social media. We can use influencers. Then we can use apps. We can use apps to clearly talk about contraceptives in detail. Basically, we should make contraceptives accessible, especially to the rural woman, because that's why you find people having so many children. And it's also crucial to show or to educate and empower these women and show them that they actually have autonomy over their bodies. They have the power to use whatever they have to use. Yes. Because at the end of the day, it is them and not the man. You're going to die and live. You're going to die maybe because of PPH after delivery, and you leave the man there and he's going to go and remarry. Yes. Lastly, it is important to involve the boys and the men in this conversation.
Oh, yes. This is the MedSquad podcast. As Boys to Men sang, I'll make love to, but the problem is they didn't include contraception in that song. My goodness. How irresponsible. But you have had the responsible side of the conversation. Take over the conversation. Be empowered. Don't feel shy talking about contraceptives. Don't feel shy talking about family planning. Don't feel shy taking control of your life. This is the MedSquad podcast. Anything that you found useful or helpful, please share it with others. Please do so. That's also part of owning the narrative. And you follow us on all our socials at the MedSquad Pod. Yes, share the information. Spread the love. Men, we have a duty and a responsibility. You're not escaping. See you next time.
Yeah.